South Africa is preparing to roll out its vaccine program. The country received its first batch of vaccines this week from India. This has been welcomed by the South African Human Rights Commission. The Commission says it supports government's efforts to vaccinate as many people as it can. Government has set a target of 40 million people. South African Human Rights Commission is encouraging South Africans to take part. For more on this, South African Human Rights Commission chairperson Bongani Majola joins me now. What are some of the things, Chairperson Majola, that you've identified that heartens you, that you're encouraged by in terms of South Africa's rollout? We hear so much criticism, but perhaps it's often good to remind ourselves of the positives. Chairperson Majola, I cannot hear you at this stage. If you could possibly unmute yourself. Can you hear me now?
Thank you very much. Yes, I hope you can hear me. I say one of the things that is encouraging us at the Commission is that at least the first batch of vaccines is here. The process of trying to save lives is only now just beginning, and so we've got a good opportunity to try and do something to do away with this pandemic, which is why we are urging South Africans, encouraging them to take the vaccine, because there is a hope that if we get the herd immunity, many other lives will be saved from this, and the right to life is a very important right.
The duty of the Commission is to look after human rights. What are some of the things pertaining specifically to the vaccine rollout that concern you?
The first one is the whole issue of equal access, the whole issue of equality. We would like to see that people do not use status to get access to the vaccines, but that every deserving individual gets the opportunity to get the vaccines. Secondly, we would also wish to see that there isn't corruption in the way in which these vaccines are rolled out and administered to members of the public. That every cent that went into buying these vaccines has to be accounted for. And then also, finally, we would really like to see that the rights of people in general are not violated. There is a possibility, for example, we refer to in our statement that people can be forced to take the vaccines. We would like to emphasize that we will be monitoring that also.
Mr. Majola, we're getting information from a provincial level on provincial vaccine rollout plans. Some provinces are geared up better than others. We know that there is a historic lack of equity. Some provinces are underdeveloped. What are you seeing, though, in terms of equitable rollout of the vaccine on a provincial level? Is there anything that's worrying you in terms of information coming through at different levels, different stages?
Well, not yet. What we are doing is to speak directly to government and to the provincial governments, and we've requested information from all of the provincial governments. Unfortunately, government sometimes takes time to respond, but we are waiting for that information, and we'll analyze and deal with it. I think that by the time the second phase starts, we will be ready with all the information, and we will have engaged with each and every provincial government, because we will also be preparing our monitoring at the provincial level in the meantime.
When we talk about equitable rollout of vaccines, we have to start from the point of procurement. I know we have been speaking about vaccine procurement for a number of months now, but we still have a long road to walk with this vaccine rollout campaign. We have many more doses to procure. What level of engagement have you had with both our national government and on an international level to try and ensure that Africa specifically and poorer and developing countries also have equitable access to vaccines?
Well, we have not gone international with regard to the whole issue of the procurement of the vaccines. We actually, as the Commission, have not done much with regard to that. What we're focusing on is to see to it that once the vaccines are here, they are properly used and equitably distributed. There is the saying, from government that as long as we can vaccinate a certain number, then we will be able to deal with the vaccine. But we'll look at whether or not this means, therefore, that we have to check whether each province has been successfully, equitably provided with the vaccines. Of course, we have to, because you can't give just a few to one and so on. You've got to look at the population and then, judge how much do you want to give to them so that there is a fair distribution of these vaccines.
Thank you very much for your time. We're going to leave it right there. That was South African Human Rights Commission Chairperson Bongani Majola.